Hello, live stream. Welcome to Lady D's Health and Wellness Center U.S. virtual webinar. These U.S. webinars are a regular feature occurring on the first and third Saturday of each month from 10 a.m. to 11:30 a.m. Eastern Standard Time. You can count on us to be there for you. Watch Lady D's Health and Wellness Center U.S. on Facebook, YouTube, and Twitter. Lady Dobbs thanks you for the viewing audience, for tuning in on this very important topic, the importance of oral health. The mission of this U.S. webinar session is to provide educational and inspirational support to individuals who aspire to achieve a balanced mind, body, and spirit life. Our HWC US team of experts is not just here to give advice, but is committed to providing comprehensive virtual insight and support to help you reach and maintain a healthier lifestyle. These sessions serve as a beacon of hope for those looking to improve their overall well-being. Our core values: prioritize physical, spiritual, and mental well-being. Our presenters today: Dr. Carletta Clark. Am I saying that right now? Dr. Harold Nii-Aponsah, The Importance of Oral Health, Part 1. At this point, you can ask them to introduce themselves, each presenter to include 10-minute Q&A at the end. So would you like to present yourself? What would you say about tell us something nice about yourself?
Dr. Well, Harold? I could start. Yes. Thank you so much, Dr. Leland Jones, and then Dr. Carter. So my name is Dr. Harold Nii-Aponsah. Originally born in Ghana. I did my dentistry there, moved to the United States, did a Ph.D. in the United States in Northern Illinois University in public health. Then I did my residency in dental public health. So I have a passion for the community, I would say. Currently, I'm a general dentist. So I'm an urgent care fellow. So if you come to Eastman, I'm at the urgent care. I attend to emergency dental situations and things of that sort. So that's just a little bit about me. I love the community. I want to help as many people as we can with the little gift I have of dentistry.
Praise God.
Thank you.
Hello, everyone. My name is Dr. Carletta Carter, and I've been in dentistry for over 40 years. I enjoy what I do. I have been a dental assistant initially. I've worked in the community all my life in community dentistry. I have a bachelor's, master's, and a doctorate in Christian education. I'm a licensed dental assistant for New York State. I went to University of Buffalo, ADAP program for that as well. I'm an assistant director at Eastman Institute for Oral Health and Community Dentistry. At any given time, you will find me out doing presentations to a vast number of people about the importance of oral health. And I'm very grateful to be here today.
We're very grateful to have you. Okay, well, let's get started with the first slide. Oral health. Now, if you'd like, you can send us a question or comment, and we will have question answers at the end to open it up. What is
Thank you so much.
Okay. What is oral health?
So what is oral health? Okay.
Go ahead.
Sorry for cutting you. So I thought it was my time to just jump in. So what is oral health? And one will ask, what does it entail? What does this, unique word, two combination of words, what's it all about? Um, Oral health. Next slide, please. So the definition of oral health, according to the CDC, it refers to the health of your teeth, your gums, and the entire orofacial system. Basically, everything by this time, everybody on this call knows what the mouth is. So everything that's related to that and around the mouth is what we call as oral health. Now, it's important that we consider this part of the body one of the most crucial parts. You cannot live without. Imagine being without a mouth. There's nothing. The stomach is doesn't have any use. Your brains don't have any use. So it's very important how we take care of this particular component of the body. If you look on the right side, you see a picture of the mouth showing very, very minute details of what's going on. Obviously, if you've seen your mouth before, you know what the teeth looks like, what the red part of it looks like. We'll go deep and zone in on what types of teeth they are and what's inside the teeth, and then we start talking about. So basically, we talk about the healthy part of the mouth, or when the mouth is healthy, what you should see, and then we now talk about when it's not healthy, what you'll be seeing, and how we can resolve that and how we can solve that. With this mouth, like I said, you can see the tongue, you can see the uvula, the cheeks, the palate, and things of that sort. This is a fairly healthy mouth, no problems, as you can see. Next slide. Then we just hone on into the types of teeth that we have. Now, basically, there are four sets of teeth that we have. I'm going to start from the back to the front. So from the back, what we call the chompers. We call them the molars. This is the last three teeth you have on both sides, upper and lower. The molars' real function is to just help you crush and grind foods. They are the main thing, and you'd come to know that they are the most, because of the way they are used, they are the most delicate or the first to go. If there's any problem, you realize that all the oral diseases starts from the molars, because they are being used every day to chew, to mastication. Everything happens at the back. From the back, you come to the premolars. So they are the next two from the back. The premolars, help you to kind of chew, tear food, grind. It's kind of a transition between the front and then the back teeth. So they help you to grind and then chew at some point too. And these are very important as well. The canines, as you've all seen them, it's the ones that are sharp. If you look at some animals like the carnivores, like dogs and lions, and they have longer of that. The cats, they have longer because that helps them to tear food and rip things apart, especially for meats and things of that sort. So we as humans have the canines to help us tear food, rip apart things. We use the canine for that function. Then for the two that are next to it, we have the incisors. Now the incisors are in two different. We have the two main ones at the front, which is just the central incisors. Most of us smile with that. It's the beauty point. Then we have the lateral incisors, and that helps us to bite, basically to bite food. So you bite food with the front teeth, then you kind of switch it to the next, and then they tear it apart, and then you now chew at the back. So that's how the teeth in the whole mouth works, basically. Again, the ones that you see that there's so many problems is the one that we use often. That is the molars at the back. So you realize that as you age, the molars become weaker, they go off, you miss them. Currently, I was mentioning earlier that I work in emergency. Most of the extractions that I have to do, taking out teeth, I'm mostly taking out the back ones, because most people present with faults on that ones. Dr. Carter, you want to add to that, or we move to the next slide?
We can go to the next slide.
I'd like to ask a question. Now,
Yes,
looking
sure.
at this mouth, people argue that are we supposed to be carnivores or herbivores? Are these teeth more for vegetables and fruit, or are they more for meat, or both?
That's a great question. So God's wonderful nature made man a mix of both of them. So when you look at like the herbivores, they don't have the, they don't have some particular teeth, they don't have the canines, they don't have all of that. And when you look at the carnivores, they don't have the incisors and stuff. They also don't have the front teeth, they just have the canines, and then for the function that they have. But for some reason, or for God's unique way of making man, man has a combination of both. So man is called an omnivore, which is a combination of the herbivore and then the carnivore, because we have everything that's in the carnivore, which is the people who just chew meat. I mean, the animals that just chew meat, and then the herbivore, the ones that just chew the grass. So we have both of them in function, all four of them. So that's the unique way, humans were created.
That's
Even
good. That's good to know. Thank
Thank
you.
you.
Okay, next slide.
So the next slide kind of zones into the tooth itself. What is happening? What we see it outside white, but what's really inside it? People come and say they have a nerve. They said, I feel pain in my nerve in the tooth, and and it could be true, but we have to see what exactly is the nerve and how it behaves. So when you look at this particular slide on the left, I like the left better because it's more clearer. The white part you see in your mouth when you open your mouth is the enamel, and that is the shiny part. People want lately. People are using veneers and stuff to make it look more white, and that's the beauty spot, the enamel. Right underneath the enamel is the dentine, and then the dentine's sole goal, or the sole role the dentine plays, is in charge of sensitivity. So when someone says I have sensitive teeth, it means there's a leakage from the enamel to the, so there's a communication from the enamel or outside to the dentine, because it's supposed to like kind of throw off an alarm for sensitivity. That's just an exposure. That's what the dentine does. Then we have the pulp. As you can see, it's the whole, we can call it the engine or the whole storehouse of the teeth. The pulp contains your blood vessels, your nerves, and so when people say that I feel the sharp pain in my nerve, the nerve they're talking about is the pulp. That's where all the action happens. Now, that sharp pain, we'll come to talk about it. It's just because you're feeling your dentine. There's a sensitivity there. It's not the nerve. Nerve pain is really pain, constant pain that you can't do anything about. Then we have the root canal. So the pulp is there, and then the pulp has little horns that connect to kind of the bottom of the tooth. And that's where, the canals are. The pulp is lined clearly in the canal, like those two horns that go down. Those are the canals. So when someone says you have to do a root canal, it means that you have an infection in the pulp, and they have to go there, remove the pulp, and clean out the two horns. The root canal treatment, that's that. And all of these things is firmly seated in the bone, the jawbone, the upper maxillary bone. You have the tooth seated firmly in there. And as God's unique way, as part of to get cushion for the teeth, we have something we call the cementum. It's kind of a cement, regular cement that we have, concrete that you have, that kind of helps you with, it's like a shock absorber for the teeth. So when you grind, it rocks like this just to keep everything safe. We have the cementum so it doesn't hit on bone. So that's what the cementum does. And we have the gingiva. Gingiva is everything red around the tooth. It's your gingiva. It's what we call the gum. So you see the gum, and then we see the cementum, which is like the little shock absorber. Or if you bite too hard on something, it just rocks a little bit to just keep it without breaking the bone or anything like that. Then we have the roots itself with the roots canal in there, the pulp. Then we have the dentine for sensitivity. It's like a trigger for sensitivity. And then enamel, which is the beauty part. It's the hard part. It helps to all the function. Next slide, please. So we cannot talk about the teeth itself without talking about a very key part of the the whole mouth system. And the key part is TMJ, or the temporal mandibular joint. It is that part that we have here. So someone could wake up in the morning and say, I feel pain in this part of my face, my joints. I feel pain on this. That's it's also an integral part of the mouth. So we talk about the teeth, the gums, and then we talk about the TMJ as well, because it helps with opening and closing. Now, there are so many muscles that are attached to this particular joint that help you to drop your jaw and put them back. If you look on the slide, there's what we call the articular disc. over there. It's like a little cushion that covers the TMJ, the joint. It kind of goes around the bluish part. It covers the whole joint. And it's there designed in such a way that if there's a reduction in the height of that particular cushion or anything that goes wrong with that, it's pain. It's a symbol for pain. Now, people sleep at night and then, they clench their teeth when people are stressed. Or if you're stressed, you realize that you grind. People say they are grinders. And the more you grind, the more you keep chewing too hard, you are just kind of weakening the articular disc that you have there. And that is pain. So people present in the clinic with pain on their joints. And it's just because, for the last 3 weeks, they had a job, a problem at their workplace. They were stressed about a stressful situation and they were chewing too much. So at night, they are grinding, and that presents with so much pain on the joints. And this is where it's coming from. That's how the joint is designed. Next slide, please. Dr. Carter.
So then we asked the question, and thank you very much, Dr. Harold. That was very great. But why is this so important for us? Why, we people of the Most High God, why do we want to talk? And for the community, for these United States, why is it important for us to discuss oral health? So oral health is a part of general health, and oral health offers clues about the overall health. Problems in your mouth can affect the rest of your body. The oral cavity, as Dr. Harold has presented, acts as a window of a lot of systematic diseases, and it serves as a part of the entry of various diseases that can affect your oral health. The 3rd of John 1 and 2, he said, "Beloved, I wished above all things that thou mayest prosper, be in good health, even as thy soul prospers." So when we're looking at this for our church members, our church choirs, our soloists, it's crucial for us to have good oral health as we are singing. The tongue, the jaw, the cheeks, the lips are significant, and they need to be in position. And this allows us to have a clear sound, and it limits us from straining our voice and our vocal cords. Next slide. So the voice of our preachers and our altar workers and our ushers, it's vital work in God's house, and our oral health is very important. So we need to ensure that we keep our oral health up to the healthiest point that we can. Next slide. Next slide. So common facts about oral health is that African American adults are more likely than other ethnics or racial people to have periodontal disease. Compared to our white counterparts, African Americans are likely to develop oral and throat cancer, and they are less likely to have diagnosis in the earlier stages and will have a lower 5-year survival rate. And just want to say briefly is that oral health, dental caries is preventable. It's one of the most common diseases that is preventable. Next slide. If we look at this draft that we see, the adults and seniors of color are more likely than whites to lose their teeth. If you look at the draft, you'll see that 29%, that's a higher rate than all of our other counterparts when it comes to having good oral health. Next slide. So we'll see that adult women are less likely than men in every age group are less likely to have severe periodontal disease. Generally, females tend to visit the dentist frequently than men. So African American women has a substantially lower incident rate of oral and throat cancer compared to African men, respectively. Next slide. Children of color are less likely than our white children to see a dentist and receive preventative care. And one of the reasons why is because of our income level are not covered by, we don't have private insurances. If we do have Medicaid does cover dental care, and there are other related programs for that. Next slide. So adults living just above the federal poverty level and part-time employees generally don't receive dental insurance. And due to this leads to untreated oral disease in adults, which can cause pain infection, missing days at work, missing church, and all activities that are related, which does cause low self-esteem, and we're not able to just function throughout the day because of dental pain. And I think probably all of us somewhere down the line have experienced having some dental pain. Next slide. So our older adults, which we're being blessed, we're living longer. By the year 2030, it's going to be 72 million seniors at the age of 65 with this data. So it's important, it's vital that we take the opportunity to get proper oral care. As I stated before, I just want to say it again, oral health is a part of general health. Next slide. So our older adults, we have some psychological changes. And this is why it's important that as we move forward, we want to now take the opportunity to have good oral health. As we get older, we have some changes in our lives. Medicines can affect the absorption, can cause us to have some gastrointestinal problems. We have hearing losses, increase of risk of fall, or mental and emotional function impairs. And you'll find that at times when we're dealing with other health issues, we lack in taking care of our oral health. Dr. Harold, anything you want to say with that? You're on mute.
Thank you so much, Dr. Carter. So yeah, it's just like you mentioned, there's several, it's just because as you keep growing, as a human being, it's just like you switch on your car and leave it on running for 20 years. It gets to the point there's going to be a problem. Something is going to happen. So the older we get, the more we have comorbidities that come in. You're treating, we have diabetes happening, we have hypertension happening, and all of these things brings about several changes in the body. And it's very particular for and the medicines that we take, the medications that we take to solve some of these problems, presents in oral health as well, which we'll be talking about in the next few slides.
Next slide. So yes, it is true that sometimes over 50, secrets are safe with your friends because you can't remember them as well. But what we want to do is we want to make sure that we bind together and we work together on our oral health, because again, oral health is very important and it is a part of our general health. Next slide. So now we want to talk about some of the oral conditions that are caused due to many issues, as we were having conversations about medications and certain health issues that we do have. And the first one is xerostomia, which is called dry mouth. And dry mouth, we receive that sometimes due to some medications. It's kind of great if we start medications to kind of give you a paper at the doctor's office and they tell you what some of the side effects are, which are a multiplicity of a lot. But sometimes we have dry mouth due to medications. Also, sometimes due to medications, we have attrition or abrasion on our teeth, which we're going to see a couple of visual slides a little bit later. Gum problems that we have, which is gingivitis and periodontitis. And we're going to look at, because of some of the conditions we have, could cause tooth caries, or we can become at risk for root caries. And then again, there could be an increase of tooth loss caused by tooth decay and gum disease, which again, I want to just repeat again, which is preventable. Dr. Harold?
Yes. So just like Dr. Carter mentioned, we have for xerostomia, she was talking about some basic drugs like some diabetes drugs tend to have that side effect as well. We have cancer treating drugs. So some people have cancer and the medication is helping out, the treatment is helping out, but it's causing dry mouth as well. And what dry mouth does is that it creates a very good condition for bacteria to just set in. So it's dry mouth, you feel punched, you feel your tongue is chipped, it's cracked, you feel soreness in your mouth, but then again your teeth is dry too, so you have a very perfect environment for cavities to begin. And so it's actually the drugs that is causing that. Generally, as we grow too, we have physiological changes. We have the ducts that release saliva just gets, they get hardened just by natural. I mean, the more you age, it just changes a little bit. And once that happens, you just get dry mouth in there. Some systematic diseases that we have, like diabetes, like hypertension, even pregnancy. Pregnancy causes the gingiva itself to change. So it causes the gum to change. Diabetes causes the gum to be swell up a little bit. Just because there's hypervasculation, there's so much blood being pumped around there, so the whole place becomes inflamed. And what happens is that makes the tooth weak. Remember, I showed the slide of how the tooth stands, with the gum beautifully covering it. So it makes it weak, and then the teeth start becoming wobbly and they start falling off, and then you have tooth loss. So that's that. Next slide, please. Oh, okay.
Dr. Harold?
I thought it was me going out. So so looking at xerostomia, like I mentioned earlier, it causes, I kind of mentioned this earlier, you have a dry mouth, that's what it's called, and that leads to increased cavities. Your lips are cracked, you feel very thirsty. And people complain that I don't know what's going on, but it's actually your drugs, the side effects of some drugs that you're taking, some medications you're taking is causing that. Some conditions too can cause that. And the fact that you're just aging, it comes with this. You have a fissured tongue, that is your tongue becomes cracked. You start seeing lines on your tongue, usually very painful, especially when you eat spicy stuff, or when you have any hot food, you just feel it a lot more. What are some of the remedies that you can solve this problem with? It's important that you hydrate a lot, you sip water, and sugarless drinks often, because you could sip water, continue taking a lot of sugar drinks, and then you cause another problem, with diabetes and things of that sort. It's also necessary that you chew you chew sugarless gum. And it's important, sugarless candy. The more you have all of that stuff, you're stimulating the glands, the salivary glands, you're stimulating them to release saliva. So though they're all hardened up, they don't want to release, but the more you chew gum, you realize that you have more saliva in your mouth. So it's important to chew sugarless gum, because you don't want to cause another problem. You have to avoid tobacco, avoid smoking, avoid alcohol and salty foods as much as possible, because salty foods, for some reason, cause you to not simulate saliva so much. It's if you have a humidifier, you want to use that at night if you feel you have a dry mouth. And one thing we can do as dentists and doctors is that we can prescribe artificial saliva. So they have these little pumps that they prescribe for you, and then you just squirt that in your mouth, and that helps you to, it acts as saliva for a little bit. And that's a case. We also have dry mouth, I forgot to mention, among people who use dentures, partials. You see them, they have a lot of dry mouth as a result of some partials are not, unfortunately not constructed so properly. So some of them sit even on your glands, so the saliva is not getting into the mouth and things of that sort. So that's about dry mouth. Dr. Carter, do you have?
We can go to the next slide.
I'd like to ask a question about this
Sure.
picture with the person with the lesion on the side of their gum, their lips there. Is that angular stomatitis, or is that, which is a virus, I think? And but you're saying that's because of a dry mouth?
Thank you for your question. So yes, it looks like herpes labialis, angular stomatitis, but it's colitis. It's a sign or a symptom that you see with someone with a dry mouth, because you tend to have the dryness. There's no saliva that lubricates the whole region, and they tend to have the sore that usually starts from here, and then it moves on to the angle of the mouth, and that becomes chapped. And when it dries off, it looks like herpes labialis, but it's actually not. It just looks like it.
Well, herpes certainly is a much worse thing to have than a dry mouth. Herpes in your mouth. Anyway.
Very painful. So we have a couple of visuals for everyone to look at when it comes to attrition. And when we're looking at attrition, you will find some people that are on specific medications and sometimes seniors that grind their teeth. So you'll see in several of these pictures, you'll see that it is in the molar areas, and you'll see that is in the anterior areas. And this sometimes can be painful. We call it as well bruxism. So it's the wearing of occlusal and incisal surfaces of a tooth. So we want to make sure that if we're seeing this or we experience it, it could be even a part of your family. This is something that really needs urgent care from a doctor. There is really nothing over the counter that could help with this, but there could be several issues that a doctor could help refer, or we need to maybe take a look at some of the medications that you take that may cause you to actually grind your teeth. Dr. Harold?
Thank you so much, Dr. Carter. Well said. Now, looking at some of these slides, you realize that as we age, we tend to grind a lot for some reason. I say that for my dad. My dad is about 67, and I looked in his mouth recently, and all I saw was, he barely had any teeth, and it's just because of nutrition. He's just grinding, and it's natural physiology that comes with it. Attrition is just tooth wear or tooth loss by the tooth themselves. They just keep biting on each other, they keep chewing on each other, and it's typically worse for people. Again, if you're in a stressful situation, some people unfortunately going through some marital issues, going through work issues. Even students have been, there's a huge recently in the practice, we have a lot of students coming with both TMJ joints, pain, and then grinding. And it's just because they have an exam coming, they grind so much that you see the tooth is all worn down. The solution for some of these things is just, giving a night guard. You give them a night guard that you can have, like the one the boxers wear. You have something similar, you put at night. Again, it's very uncomfortable to sleep with something in your mouth. So some people tend to not use it and, just stay like that. There have been some medications which have proven to help. They give you some muscle relaxants for your night. So you take a muscle relaxant and it help you to, your muscles are all relaxed. You just wake up fine. But again, there's no real solution tonight to grinding. It's important that we are aware of some of these conditions and be proactive about it. If you see things like this in your mouth with the pictures, I would say you should rush to your nearest dentist or doctor to have it checked.
I'd like to make a comment about this as a physician and a psychiatrist, that one of the things that you might consider suggesting to them, especially grinders, is that it's like they're grind. It's like things are so tight and impossible that they're grinding their life. They're grinding their problems. So one of the scriptures that's very good for that is to cast all your cares on Him. So we unload our burdens, we cast our cares. And I know that as in psychiatry, we really use that a lot. I'm not going to get into that too much right now, but that's a really powerful, to unload our burdens on the Lord. That way we're not grinding them, trying to fix them ourselves.
I totally agree with you, Dr. Jones, in regards to that, because as you just stated, sometimes we get in stressful situations that we really think we have it under control, where we need to cast our cares onto the Lord. And then we find these underlying issues where have we, and like you said, it's another discussion to have. But a lot of times when we come in, and again, as we talk about, it does cause low self-esteem. It does not let you feel well, especially if you're in the workforce and you're struggling with things and this appears in your mouth that you are a grinder. So as Dr. Harold just stated, urgently, we would request that you go in. That's why it's important that you go like every 6 months to the doctors, because in doing that, it allows them to review your oral health to see if there's anything that they definitely need to address immediately.
Amen.
And
especially if you're a sensitive person. See, we'll be the more sensitive, more caring, the more intercessors, burden bearers, they are going to be, they're like holding the world in their mouth.
Yes, absolutely.
That's true.
Go ahead, Dr. Harold.
Yeah, so one of the, just like you mentioned, with all that's happening, one of the things that would prompt you to know that this is happening to you, sometimes you may not be aware that, there's like, Dr. Jones mentioned, you may not be aware, you just care so much, you may not be aware. One of the things that will prompt you is that when you take cold water, you start feeling, the sharp pain, because now you've worn the enamel so much. Now we are talking about the dentine. Remember the dentine I mentioned earlier is just in charge of the sensitivity. It's a trigger. It throws off the sharp pain for you to know that something is off. There's a communication from your mouth to the inner part of the tooth. So once you start feeling that there's something off, you start feeling pain when you take cold water, when you're in a colder environment near an AC, you start feeling pain. And like Dr. Jones mentioned, Dr. Carter mentioned, you are an overbearing person. You just have to know something is going on, and you have to get that attention as soon as possible.
Thank you. Next slide. So we want to discuss abrasion, which is the loss of tooth structure. And if you see over here on my right-hand side, you'll see this pretty colored toothbrush and the bristles are just all worn out. And you'll see sometimes that, and we want to just deal with it, Dr. Harold and I, that a hard toothbrush is not the answer. And when you use a hard toothbrush, because a lot of times we think, using something hard causes more cleanliness, but you can see that some of the results of using a hard toothbrush is abrasion. And you'll see where if you think brushing your teeth really hard, and this is some of it, this is not the answer to all of it, but using it causes you to have some abrasion to your teeth. And this does not go away when you start to use a soft toothbrush. The way that this goes away is that we have to rebuild the structure by you going in to see a doctor. As Dr. Harold stated, going into a room with a cold air conditioner or cold water will now start you to have some discomfort. That's why we recommend that soft toothbrushes are best for brushing your teeth. Dr. Harold?
Thank you so much, Dr. Carr. So just like she mentioned, the toothbrush, I'm from Africa, and back then in Africa, we have that notion that the more you hear the sound, it has to sound shoo, 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 then you're brushing your teeth. We used to polish shoes with the little brush. So once you hear that sound, you're brushing, but actually the damage is being done. Now, if we look at the size of the toothbrush and the size of the tooth, if you keep doing the hard toothbrush and the bristles are not moving, you are now aiming for your gums. So what you're doing is you are pushing your gums further away from the tooth. And that's why we have that here. So you're brushing, let's say you are technically brushing your gums off with that, because the gums are very brittle, a brittle layer laying over there. So you're just pushing it further back up. And the body reacts to stuff. The more you keep pushing it, the more it keeps going. And problem is that, just like Dr. Carter mentioned, you have sensitivity. In a cold room, you feel so much pain. You drink cold water on one side of your mouth. You start, we call it the bite of convenience. You bite and you're like, you want to bite on this side because you feel sensitive, on this side. So some of the symptoms are that you might want to just go to the dentist and have it restored. And I must say, we brush our teeth, then the teeth will look so nice, but there's a bigger problem. And this is one of the most difficult fillings to do for a dentist because it's a habit. So I can fill this tooth on this side, on all of the side of the neck of the tooth, and then the person will go home and still continue using a toothbrush and brush them off. So it's usually it's a challenge to deal with this particular cavity that we have here. And so it's important to use a medium to a soft toothbrush. It's just like one of my professors said when I was in dental school was the most important action is there should be an action. You are brushing it's like brushing your shoe. It doesn't matter if the shoe is a hard toothbrush, it's a hard brush brushing your shoe, or it's a soft brush brushing your shoe. Once you are brushing, that's the most important. So a soft to a medium is really what is recommended. The hard, back in the day, they used to call it a smoker's toothbrush, where it's when people smoke, they had all the stains on their teeth. So the hard one was to kind of take off those ones. But with the new medium soft, the technology that they have, it does the same thing. It's more efficient to use a soft toothbrush. Just make sure you spend more time brushing with a softer one.
And what would you say about electric toothbrushes?
So I don't use an electric toothbrush, but I know research has shown that it is very efficient. It circulates, it shakes and vibrates to do the same job you're doing. Um, Personally, I don't use it just because I don't have it. But it's something that I recommend for people. People have mentioned, research has shown that the more they use the electric toothbrush, they feel better and cleaner, and they feel covered. Um, it's 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 shown enough results that I would recommend. So if you can afford that, you can go for that. If you cannot afford that, you can still use the manual strokes, and then you have the same result as electric.
And what would you all say about the type of toothpaste? Did I go ahead of myself here? What is the best? And some people use peroxide. Some of them say, this, you shouldn't have this in the toothpaste. And are you going to come back and talk about that, or is this a good time right now?
I think there's a slide about fluoride at some point, which was about, yes, I think it's in the slide. We might come back to that, but I
Okay.
can talk a little bit about it. Okay.
Yes. So we want to talk about tooth decay. What is tooth decay? And tooth decay is also called caries, or it's called cavities. And decay is a permanent change that occurs on your teeth when bacteria and acid eats away at your tooth, producing tiny holes, or what we call cavities. So this is why it's important that we work on, number one, as I continue to say, prevention. Every 6 months, going to your dentist. Um, and in that 6 months, what you will normally get is an exam, x-rays, and you'll see here at the top in the black and white that that's an x-ray. And that x-ray is showing the doctor that there's caries there. So, in just briefly, and Dr. Harold, please chime in, that decay that you see that's a little darker on the occlusal part didn't happen overnight. So it's important that if we were to go to our dentist every 6 months, this could have been detected, as Dr. Harold went over some of the anatomy of the tooth earlier and kind of broke down the different parts of a tooth. This is very close to the pulp. So where a dentist could possibly do a filling, Dr. Harold, your expertise in this may not
Thank
be a
you.
basic filling.
Absolutely. Thank you so much. So it's important to know, just like Dr. Carter mentioned, the way bacteria behaves. It just needs the right environment. And once you enable it, that's it. Uh, the enamel has been shown to, when the human body, people die and, they're in their grave and everything, the tooth is the one that it doesn't go up, but it's still going to be there forever. That tells you how hard the white part of the tooth is. It's very strong. So the bacteria struggles to go in, but as you enable it, it just needs an opening. It's going to spend time trying to dig, dig, dig. And once it gets into the dentine, which is the yellow part, that's it. The rest is a matter of days and a matter of, it's months. But it takes them years to get through the enamel if you don't brush and stuff. So the cavity is a result of bacteria. Now, when there's a cavity that is just a little small, tiny one, we as dentists can come in and use a filling. As you keep moving down, it becomes progressively difficult to make the filling. Once you get into the red part, which is the pulp, then we are talking about root canals or taking a tooth out, because there's not much we can do. Because if the bacteria goes on, it's going to go underneath the tooth, and that's going to cause the swelling and everything that we usually have. So someone starts at a small decay, a small tooth filling, but like now they just use oral gel and stuff to just control the pain, but the bacteria goes down, and the next thing you see, they have a swelling on their face, rushing in there. So it's important that any hole you feel in your mouth, just go to the dentist, have your 6 months check, and then let them seal everything, because it's you can arrest the caries, you can stop it at any point. But if it goes beyond some places, then we have to look at ways of solving the problem.
Next slide. So based on just the what we're talking about when it comes to tooth decay, this is another image that actually shows you the advancement that Dr. Harold was showing. So if you go from my left to right, you will then see where it says inflamed pulp. If you're visually looking down at the bottom, you'll see that little circle ball, and that's where an abscess has occurred, which will then, a decision will have to be made if it's going to be a root canal or an extraction or an implant. All of these are very costly. Again, I'm going to keep on saying this. So if you get anything out of this, prevention is the key. Dr. Harold?
Absolutely right. Prevention is the key. And Dr. Carter said, like I mentioned earlier, once you get to the third stage, there's not much anybody can do. You can push for a root canal, then you have to cover it up with a crown, and it's expensive, or you can just take it out. And then you start losing tooth, you are not chewing properly, and that's a whole mess. Currently in the urgent care clinic that I work, from 8 a.m. to 1 p.m., we take about 80 teeth out. That's how every day, just between the morning, by 12, we have about 80 extractions that has been done. So it tells people are progressively losing their tooth. It's a big concern. And I get worried as a community, dental public health specialist or a community dentist, I get worried. So how do we, it becomes a bigger problem. So what are we doing? How do we replace that? Where's the money? Why are we watching this to happen? So just like Dr. Carter said, prevention is important, and it's what we have to do to prevent this.
Next slide. So as Dr. Harold had discussed about bacteria, there are good bacteria and there are bad bacteria. So bacteria we will have in the mouth. But if we were to follow prevention, good oral health, brushing our teeth, bacteria can be removed. If we do not, as you'll see on the right side, you'll see at the top and down at the bottom, this is the effect of not taking care of the bacteria in your teeth. However, again, as I said, with proper oral hygiene, these bacteria can reach levels that may lead to oral infections, such as tooth decay and gum disease, as we will definitely go into moving forward. Next slide. Dr. Harold?
So some of the symptoms you see is just a regular toothache. Your head hurts. It's from your tooth. Tooth sensitivity. You feel sharp pain over there when you drink cold water and stuff like that. Now, you have a pain when you're eating or chewing something sweet or cold. All these are symptoms that you have a decay going on. You have a cavity happening. When you bite down, could be a result of a bigger problem because you saw the bacteria underneath the tooth. When you bite down, you're biting on that inflammation, and that's going to be tremendous pain. All these are symptoms of having a tooth decay or cavity or caries.
Next slide. Just want to show a couple of those. And these are decay. These are caries. Some of them are restorable. Some are not restorable. As you'll see over to the right, to the lower, I believe there it looks like a crown that has been placed due to some decay, but because of no prevention, now we start to have more discussions of the need to get this mouth in the most the best oral health possible. Because as you take a look at it, you'll see this can start to cause other health issues that we're going to discuss quickly in a few minutes that will affect your oral health, which is a part of your general health. Dr. Harold?
Yes. So thank you so much, Dr. Carter. So what are the treatment options? Like I mentioned earlier, depends on how progressed the particular caries or the cavity is. We can just do a filling. We can fill with regular cement, which is composite, or we can just move further. Sometimes if it's at the back and we need more support, we use the silver fillings, which is amalgam, because amalgam is very good to keep the grinding together. We don't put amalgams at the front just because they don't look nice. You have metals at the front. So composite, some recent composite are strong as amalgam, so we stop using the metallic fillings. If it's gone deep down to the bottom of the tooth, then we have to do a root canal. If you do a root canal, means we are going in there and then taking everything out of the tooth. We're just killing the tooth basically. And once that is done, we have to protect the tooth with a crown. So after a root canal comes a crown. And between the two, we are talking in the most cheapest office, you are talking over $3,000, $4,000, and that's expensive just because you missed out the filling stage. You might want to avoid that as much as possible. And some insurances don't cover the root canal, so then we have to extract the teeth. That's the last option we have. If finances is a problem, then we have to take the tooth out. Some teeth that we have are unrestorable. So when you look at the tooth, it's just there's nothing left. It's just that there's something in the gums. There's no tooth left. So then we have to just take it out because you can't do anything about it.
Can you say something about the mercury in the toxicity in the fillings?
Absolutely. Thank you. So one of the problems that research showed earlier was that mercury, it started with that argument that mercury, which was part of the amalgam is the compound, so mercury was an element, was that mercury caused several problems. Toxicity, it went into your lungs and your liver. It just caused mercury toxicity, which was very bad even for unborn children. But then they realized that there was a component of mercury called, free mercury was really what was causing the problem. Free mercury was mercury, which we have even in our mercury, which we have in our sphic. When we check your blood pressure, the thing that goes up, the older blood pressure machines was mercury. So the same thing we have in amalgam that we use. But free mercury was actually the problem, not the mercury in the compound. So research has debunked that well, free mercury is a problem, but if you put it in an amalgam for your mouth, it really wasn't an issue. But just to cause, and people were still skeptical. It's like the fluoride right now. People say fluoride is bad, fluoride is good. So to avoid everything, dentists have stopped using amalgam at all. There's some research showed that it was a problem. Some showed that it was just the free mercury, which really wasn't there. But to just avoid all the contradictions, really, it's very rare that people use mercury in your mouth lately. In the last 10 years, we don't see a lot of fillings with mercury. So older fillings that you have, you can have the metal mercury in there, amalgam in there, but recently nobody goes away. Everybody goes away from it.
Well,
so it's not something we should worry about. Thank you.
Next slide. So what we really want to talk about when we talk about prevention is gum problems. And as we took a look at a lot of the different models, or actually your oral mouth, your gums house your teeth. Without good gums, we could lose our teeth without even having caries. And as I said, when we have gingivitis, you'll see the first one is when your gums are red and swollen because they're irritated. Gingivitis is, we can actually treat gingivitis. It looks like you have a sore mouth, but your mouth, it looks and still feels good. But if we were to go in to have treatment of it, we can reverse gingivitis. When we get to periodontitis, this happens when gingivitis isn't taken care of. This is when the irritation spreads deeper into the gums, and you'll see that it now starts to affect the bone that holds your teeth in place. It's the problem that gets bigger and it starts to even hurt more. Next slide. Dr. Harold.
So yes, rightfully said, Dr. Carter, this is what gingivitis looks like. Gingivitis is just inflammation of your gums. It's when you don't brush your teeth often, or you don't take care of a particular teeth. It could be just one tooth, maybe at the back, that your toothbrush is too big, it doesn't go to the back. It could start from there. So what happens is that you see plaque, which we'll talk about. You see calculus starting on there. It's whitish substance around there. And then the substance gets in between the way of the gums and then the teeth. Then you see the body reacts to any foreign material by, puffing up, by putting inflammation there. And then your gingiva or your gum just swells up to kind of give you an alert that there's a new thing here. It's not part of your body. And that's what gingivitis is. It's just the swelling of your gums that happens. And it's usually very painful. It's red. You touch it, you feel so much pain. It mimics tooth pain, but it's actually your gums that are hurting so much. When you brush, you bleed. One of the symptoms of gingivitis is when you brush, you see blood coming out of your mouth. yes, you're talking about gingivitis because it's swollen and you are rubbing your toothbrush with it. So you see blood coming. If we don't take care of gingivitis, it just moves to affect the bone beneath. Now, once the bone is involved, there's no coming back. Once the bone is involved, the tooth just become wobbly, just in the socket. So then they start falling off by themselves, and that leads to tooth loss. So most of the goals is that we catch things at gingivitis and prevent them. How do we prevent gingivitis? You have to come for a professional cleaning. That's where cleaning is important, because there are some places your toothbrush will not go, and then the dentist has or the hygienist has a scraper, little scaler that they scale your teeth and take them out for you. Some of them, it's harder to take out with your toothbrush because you've left it there for a while. So now your toothbrush is just brushing on top of that. So the scaler helps to break it up and then take it off. So that's the difference between gingivitis and periodontitis or periodontal disease. One is just that the gums are inflamed, and then one progresses from the gums to the bone beneath, and that is periodontitis.
Next slide. These are visuals of our discussion. And as you can see, as Dr. Harold showed, the redness, if you're on my left side, right around the lower part of the tooth, that is painful. And then you see on the right side, this is hard calculus that cannot be removed by a toothbrush. I'll repeat that one more time. This cannot be removed by a toothbrush, and you definitely need to ensure that you go in to see a professional for this. This calculus, as well as this plaque, as much as you want to brush your teeth, will cause bad breath. So it's important that you make sure that you go in to see a dentist. Dr. Harold?
Yes, Dr. Carter, it's very true. Because when you have the gums swollen and there's redness, it's just like blood. When you put blood down, you have a bleed. After some time, the blood smells. And that's what's happening with your bad breath. It's just the gum has the redness. The blood is all around. After some time, you have a bad breath because it's just blood that is smelling. And it's important that you have a professional cleaning to have this taken care of.
Next slide. There's some more visuals that we want to show you. How to know when you have periodontal disease. Next slide. Dr. Harold?
Covering periodontal disease, the normal tooth, like I mentioned earlier, looks like the left one. It's their healthy gums, but with periodontitis, or let's say with an inflamed gingiva, you have the top part, which is the same thing that was healthy gums. The gums are now moving apart. And, you now have the plaque and calculus being around the neck of the tooth. And this goes all the way down to the bottom. Then you start losing the tooth itself. So this tooth now is wobbly. If you look at the left and you look at the right, I could just use my finger to shake the tooth over there because there's a space there. So the tooth starts moving. This is very normal for all of us. It's just a matter of we not brushing for a few months or a few days. We have a toothbrush that's too big for the back of our mouth, and then this starts happening. So it's important that you have your 6 months checkup, have your clean around it to cover the places that your toothbrush doesn't go, and then you should be set. It resets you back to the normal tooth on the left. So the down picture shows that a diseased gum on the left with inflammation. If you touch it with a toothbrush, you start bleeding every morning into your, when you're brushing your teeth, and then the healthy gum is the one on the right. So pretty much the difference between the two and what the two looks like.
Next slide. So as Dr. Harold was just showing you in our previous slide, now we're getting to irreversible bone loss. This is periodontitis. You'll see over on the right-hand side to the top, that is an x-ray. If you see down on your left side, down at the bottom, that's called a Panorex x-ray, where it shows the entire mouth. But it is showing in this x-ray that there is bone loss. Dr. Harold?
Thank you so much. So just like Dr. Carter mentioned, if you look at the top right, look at the two teeth. You see that the one on the left is just standing there without any support. Now, anything can kick it out. The light gray area you see is your gums. So the tooth, it looks fine outside, but it's just your gums that is holding it together. There's no bone, which is the denser part, the whitish part. There's no bone holding it. It's just in the gum and it's wobbly. At this point, there's not much you can do. They have to do a surgery where they fill it out with bone from a dead person, cadaver. It's just a long process you don't want to get to kind of, get to this point. They have to use implants and things of that sort to get something to replace the tooth back. And it's important that we avoid bone loss or periodontitis as much as we can.
So you'll then see that there's in this slide tooth loss, and then what we have done is replacement of those teeth by having dentures. Okay. Then association with other symptomatic diseases, as Dr. Harold had shared with us earlier, and we'll just go briefly, due to time, is that he shared diabetes. It's a gum disease. With your gum disease, diabetes can cause increase of blood sugars. Cancer, high blood pressure, and even Alzheimer's. And we will be back on for part 2 so we can go a little bit more in depth with it. Next slide. So as Dr. Harold had shared, we need treatment. Once we get to a periodontitis part, we will need treatment. And here it's showing you what type of treatments that we will need. Dr. Harold?
Yes, thank you. So we need deep cleaning. That we have to go down to the gingiva towards the, if you look at the top here, there's a little machine that is, squirting some water on the last picture, to go down to kind of clean underneath the gums, to take away everything that's there, so you can have the gum, the body falls back, the gum falls back once you clean whatever is in between that. It's important to floss, because sometimes you finish eating and the food dislodges and the bacteria goes in between your teeth. So the floss helps you to take everything that's over there out. There's been some medication. We have some mouth rinses like chlorhexidine. That is just an antibacterial mouth rinse. It's not one with alcohol base, so it doesn't burn. But it helps to kind of, after you do a clean, it helps to reinforce with antibiotics, that the bacteria doesn't come back over there. I did mention surgery, where you have to go in there, find some bone usually from a dead person's ankle or leg or something, and then crush the bone and then put that in the mouth to just fill out the bone that you just lost. And then there you can drill an implant in there to kind of replace the chewing function for you. And that process is kind of lengthy, expensive, and to me it's unnecessary if we can just take care of stuff before they get there. Extraction, usually you don't have any hope than to take them out. And a chunk of the people I treat on a daily is just extraction, like I mentioned. It's just sometimes you just go in the mouth and it's just the tooth just hanging in there. And then they present that when they chew, they have pain. It's just because it's just a tooth that's just there and it's just offending you. So, these are the treatment options that we have to prevent gum disease and then, bone loss as part of oral health problems.
Thank you. Next slide. So for time constraints, we're going to go right through these just to show you, and we will pick this back up in our Importance of Oral Health Part 2. But here it's showing you, as Dr. Joan asked us about, an electric toothbrush as well as a regular medium to soft toothbrush. Next slide. We definitely want to have the conversation in regards to prevention. Prevention is the key. Next slide. Which causes us to then have regular dental visits and good oral hygiene. What we do want to say and encourage each one that is on right now, we would like for you to brush your teeth at least twice a day with a fluoride toothpaste. Dr. Jones will talk about that a little bit later in our next segment about the importance of good fluoride toothpastes and dental floss. We'll talk about also special toothbrushes or flossers. But visiting your dentist, cutting down on sugar and carbohydrates is important. Next slide. And you'll see here that there's some brushing techniques that we will visit. Next slide. That includes dental floss. So you want to break off about 18 to 24 inches of a dental floss. And number one, you want to hold the floss with your thumb and your index finger. Number two, Place a floss between your two teeth. That would be number 3. And then curve it around the base of the tooth and repeat this with each step on every tooth. Next slide. And then here's some other flossers that you can use. Next slide, which includes the interdental brushes. Next slide. And then we want to make sure that we address the importance of, if you have dentures, what you need to do. Dr. Harold?
Absolutely. Thank you so much. So it's important to know that when you have dentures, you want to keep it as much as possible away from, bacteria. So you want to take it out, clean it daily, remove it overnight. Don't sleep with it, because bacteria loves it when you are closed. Your mouth is all closed. So you realize that when you don't talk all day, you have a bad breath. It's just because your mouth is closed and the bacteria is working. So when you sleep at night, it's just working. So take it out, put your dentures in water, rinse it, clean it with a soft toothbrush, brush your dentures up, to get bacteria away from it as much as possible. Some people use interdental brushes, even with the dentures in the mouth. I know I have, with a diastema here, I have a gap here. Some people have gaps around their teeth, and the toothbrush is not going to help in the gaps. The floss is not going to help. So interdental brushes just go in there and then it's kind of clean the left and the right side of the gaps that we have. So you might want to get that too as part of your things to clean out your teeth.
And then we want to discuss the importance of a good diet, which consists of fresh fruits and vegetables. We want to make sure that we limit our sugar amount to avoid caries and cavities. Next slide. And we want you please to visit your dentist regularly. This is the basis of good oral health. Next slide. We want to thank you. Thank you for your time. We want to give you the opportunity to have any questions that you may have with us. And at this time, we're going to put it back into the hands of Dr. Jones.
Thank you very much. This is very informative. This is very useful. And I hope that our audience also appreciated this. I'm sure they have a lot of questions also. So I think that the thing that came across to me is prevention. So they say an ounce of prevention is worth a pound of cure.
It is.
And in my area, this is also very important. We want to try to prevent this. Now, as we get older, and as you mentioned, that there are going to be people that have loved, I hate to say this bad word on a Christian show, but I'm going to have to say it. And that word is sugar. And I said it, and it's very destructive, and it's in everything. So whether you destroy your teeth from the outside or from diabetes on the inside, can you say something about sugar? And we're opening this up to questions. If you have questions or comments, please text those and send those in to us.
Dr. Harold?
Absolutely. So one of the things you have to realize is that it takes about 4 things. It's the 4 things that need, before you get a cavity or caries in your mouth, you need 4 things to happen. You need a bacteria to be present. You need sugar, because the bacteria loves sugar. So there needs to be sugar. And then there needs to be a tooth, and there needs to be an acidic environment to support the life of the bacteria. So our mouth has, acid, it's acid base, or our mouth has saliva, which is acid. So that is constant. The bacteria lives in the acid, so that's also constant. The teeth is constant, the one that they're going to feed on. But the bacteria is what you can control. I'm sorry, the sugar is what you can control. So you can choose to avoid, then the bacteria has nothing to feed on. Then it's going to be there, you just brush them off every morning. But the sugar is the part we all have to. Now, when we eat fruits and vegetables or having a healthy diet, you literally are controlling how much refined sugar Let me change the word and make it refined sugar is what I'm talking about. Bacteria loves that. And when that, for some reason, you don't brush your teeth at night and that is around your tooth, that's a good time for the bacteria. Just go there, eat that, eat into the tooth, and that's it. So it's important that some of these sugars are, controlled as much as possible if you can. Uh, you know, take it out of your diet just because you want to protect your teeth health, because it's the food for the bacteria.
That's so important.
It is.
So, what I have any questions here? Like I got a bunch of questions. So another one question is that we have a tendency to love certain foods. Well, let me go to this question. So, what do you think about mouthwash, mouth rinse? And I see some people say, well, you got to be careful because uh, there's the gut biome, and so in your gut, there's a book, All Diseases Begin in the Gut, and some people will say that the mouth is the beginning of the gut, and so that you want to have the good bacteria will kill off the bad bacteria, and so we want to have good bacteria growing in our mouth, and so some mouthwashes will kill off all the bacteria. So what would you recommend for that?
Correct, that's true. So usually, sometimes I use a mouthwash, but it depends on when I need it. It's like having a mint in your mouth. Like at some point, you have, again, once you close your mouth for a very long time, bacteria has a feast and it brings up the bad smells. So we have a bad breath. So when you have this alcohol-based, like Listerine and those stuff, it just kind of cleans everything out, whether it's good or it doesn't differentiate. So it cleans all the bacteria out for a period, and then that goes off. So I'm fine and I have a fresh breath because of the mint and all these things they added to that. So it's just for fresh breath. But in terms of actions itself on the gums and the teeth, um, you really can't save that with that. Imagine I have a swelling on my hand, a big swelling, and it's bleeding. And the next thing I do is put some spirit or alcohol or rubbing alcohol on there. It's going to pain me. It's going to be, hurt me. And that's what happens with a swelling in our mouth. We have swellings everywhere. And then when we take some of these things as a way of preventing, you're just hurting yourself. And it's not going to solve any problem if there's still uh, calculus and plaque attached to your teeth. It's really not going to change much. We do have some antibacterial mouth rinses that we give, but we usually prescribe that after we've done a thorough cleaning, a deep cleaning, then we give you that. So it just kind of helps to refresh, cover the areas that we couldn't get, to after the cleaning. And that, like chlorhexidine and stuff like that, that's what we do. But ideally, I would not say that mouth rinses, alcohol-based mouth, as a substitute for toothbrushing. I've seen people do that. They just, instead of brushing their teeth, they just throw Listerine in there and then they say they are fine. Yes, it gives you a fresh breath, but it doesn't solve the problem of brushing.
Thank you. Okay, now we have some questions here. Here's a question: how can we prevent gum deterioration?
So I think one of the best things that I can share, as I have repeated a couple of times, in prevention is we need to ensure that we are going to see a professional, which is a dentist and a hygienist. One of the best kept secrets, if I could share with everyone, if you were to go to the dentist every 6 months, have an exam and a prophy, that would allow the doctor and the hygienist to see if there's any underlying issues that we need to address. But for home care, if we would allow ourselves to prevent gum deterioration at home, because are given the tools and then we have to take the tools, just like reading the Bible. We have the tool to read the Bible for salvation, but we have to live it. So now let's live this. Let us every day brush our teeth 2 to 3 times a day and floss. I'm going to repeat that, and floss. One of the most important things that we need to do, and when I go out to do education, I try to share, especially weekends can be a challenge for young people, for adults. I've worked all weekend. I want to have pizza at night. I want to have my Coke. That's fine. But before you go to bed at night, brush and floss your teeth. Once you brush and floss your teeth, do not eat anything else. Drink just water. Throughout the day, if you're having high sugar contents, a lot of people love M&Ms, one of my favorites, or Reese cups, or they have a donut or some cake. Brush your teeth. Let's try to fight to eliminate the bacteria that we are ingesting in ourselves, and we just let them sit. Some of us are coffee drinkers. Some of us are tea drinkers. Some of us are Coke and Pepsi. There are people out there that love to have a Pepsi or Coke to start the day off, but brush your teeth. That's the most important. And as Dr. Harold have shared, in brushing your teeth, please do not use a hard toothbrush to affect your gums and help to help deteriorate them. By using a hard toothbrush will start the process of having some gum deterioration. So some of this is of our own. We need to brush our teeth at least 2 to 3 times a day. Floss in the morning, floss at night. There are some people that love to take the toothbrush and toothpaste to work, so after they finish eating, they definitely will be able, but this is what's going to help you to prevent gum deterioration. Dr. Harold?
Yes, you nailed it, Dr. Carter. But to add to what you said, you mentioned the point of people going to the dentist frequently and regularly. It's something we encourage. But one of the things I like to add is that when you go ask questions, it's one of the things we forget to do. The person is looking in your mouth and looking at exactly what is going on. You want to ask, how do I prevent this from going further? You want to ask, what did I do? How did I get here? Engage the dentist as much as you can. Know what's going on. Because some of the time, I mean, I see patients and I tell them, well, I see there's a problem on the last tooth there. How big is your toothbrush? Does it get to the back? You might want to, spend some time at the back, because I see there's the distribution of the cavity is not even. That means you are brushing, you're trying, but you're not getting to the back. So ask questions, ask ways in which you can improve. The dentist is going to say, yes, continue what you're doing. Are you flossing twice? Okay, well, when you're flossing, look at this particular side, look at the front. You ask questions to, kind of engage the provider to, it's your health. It's your oral health. You want to take charge of it as much as possible. You're not being a burden to anybody if you keep asking questions. I love it when people ask me questions. We get to have a conversation to make sure you are feeling okay, even if you leave the chair, that you are in charge. Because I always say that I don't want to see you in 6 months and I'm going to tell you that I have bad news. There's something happening in your mouth. So I'd love to tell you what you should do, engage you as much as possible before you, so in 6 months, we just a regular cleaning and, conversations, ask questions.
Thank you, Dr. Harold. And one of the most important, I just want to throw out to everyone that is listening, and this is good gossip to share. How long should I brush my teeth? So what we try to inform our kids is, while you're brushing your teeth, if you're in your bathroom, if you sing the full happy birthday twice, a couple minutes, that's as long. If you have a commercial on TV, 2 minutes. So we can't go in and just brush our teeth very quickly and think that we're taking off some of this bacteria and some of this plaque. You really need to take time when you're in the bathroom brushing your teeth. With a fluoride toothpaste, sometimes your doctor will recommend, if you have sensitive teeth, there's a Colgate, there's a Crest sensitive tooth that will help. As Dr. Harold was sharing with you, if you are starting to have some progression of gum disease, it kind of helps. I take it. I use it for some of my teeth as well. So I use a sensitive toothpaste, and it allows me not to have a lot of sensitivity at times when I'm drinking something cold. But I do take that time with my teeth, and I brush my teeth quite a bit when I'm in the bathroom. So again, at the end of the night, I would ask everyone to share this important information. Before you go to bed at night, please brush your teeth. Brush your teeth 2 minutes. Floss your teeth. When you're finished, please do not eat anything, but ensure, if you're thirsty, drink water. If you choose to eat again, brush your teeth. Floss your teeth.
Very good.
And that's going to allow you to have a healthy oral health.
I got a quick question here. What would you say about chewing gum, especially sugary chewing gum?
Dr. Harold?
Thank you. So like I mentioned earlier, bacteria loves sugar. You can chew your gum, it gives you the fresh breath, but after you're done, you just want to, clear, rinse. You can even, sometimes I say that if you cannot brush your teeth in the middle of the day, just rinse your mouth. Sprinkle, put the water in your mouth, swish around and just swallow it, just to prevent because chewing gum is sticky. The sugar from the gum is sticky. It sticks on your tooth. So you are done, you throw the gum out, but you still have the sugar stuck, the sweetness stuck in your mouth, the minty taste. And then the bacteria waits for you to be quiet, and then it just moves. Once you're not opening your mouth, they are anaerobic. They don't like air. So once you are opening your mouth, the bacteria is not working. So once you sleep, you close your mouth, there's no air in your mouth, then they start working. So you want to make sure that you always rinse your mouth, brush your teeth as much as possible. Sugar, I would say you want to avoid, there's a lot of sugar-free gums out there that you want to go for. They use the sorbitol and things like that, xylitol, to replace sugar. So those are very important to have in your mouth. I would say you go for that than the sugar ones. I also quickly wanted to, add.
Go ahead.
Right. So Dr. Carter was mentioning about brushing your teeth with the fluoride. But it's important to know how fluoride works in a toothpaste. So research has shown that it takes 4 minutes for fluoride to fully work and be done. It's 4 minutes. So fluoride has a half-life of 4 minutes. So it's 4 minutes. But it's very impossible to wake up in the morning and for 4 minutes you're brushing. It's kind of very, it's not realistic. So we say that 2 minutes is enough, just 2 minutes. And how after you brush your teeth, you still feel the good taste and good feeling. Fluoride is still working. So 4 minutes is enough. So just make sure you get 2 minutes in there, and then the other 2 minutes is going to take care of itself. After you rinse, it's still going to be around to work fully. So having this notion of 2 minutes of brushing, but the fluoride toothpaste works for 4 minutes. It does its job in just 4 minutes. That's important to add.
We have another question here about what is the best organic toothpaste and mouthwash to use? Christ Redemption Tabernacle Church.
Awesome. So I would say, okay.
No, please. I was going to say that is a good question that I'm definitely going to have Dr. Harold to help us with. That's a good question.
Absolutely. So I would say, there's some new recent technology. Back in the day, people used to use activated charcoal, the black stuff. They used to use charcoal to clean, and its research is shown in, Asian tribes that gave them perfect dentition and perfect teeth, prevented caries and things of that sort. So you see that now they have toothpaste that have charcoal in them, kind of black to do that, just because they have a very, very nice mattress points. They have lettuce and mattress points that when you brush off, it helps to the abrasion, helps to keep your teeth clean. I always say this, and I always tell my patients, it really doesn't matter the toothpaste you're using. Once there's fluoride, you are good. It's like having a tooth. I use the your shoe analogy, that if it's a Kiwi shoe polish, whether it's a Nike shoe polish, once you're polishing your shoe, that's the most important. Once you're having the action done, the brushing action is more important than the toothpaste action. There should just be fluoride, but the type doesn't really matter. Fluoride and then the brushing action is enough.
Very good. Okay, well, I guess we're coming to the end here. So, Dr. Carter, is there anything that you want to add, or?
No, I don't. I just thank you for the opportunity again, and we'll see you all again. I think it's in September. If you could send in any questions that you would like for us to Lady D, I want to thank her again for this opportunity to share to everyone the importance of good oral health. I know I did talk about brushing your teeth, but I want to throw this in again. Let's make sure we brush our tongue as well and give it that time as well, because that is an important part of oral health, to keep your tongue clean as well. But I want to thank you for the opportunity. May you have a blessed day and have the best day ever.
Amen. And so, and brush your gums too, because that's another place. Yes. And the roof of your mouth too. So now, if you would like to send in an offering We have some addresses here that you can send an offering, Zelle and Cash App, and you see that on the screen. And we recommend that you do that. We thank God for this. This is awesome. This is so needful, not just for this group of people, but the whole nation, the whole world needs to hear this. This is like the number one disease. I believe dental caries is the number one disease, and so it causes so many other problems. Like they say, your mouth, your mouth. Your mouth, out of your mouth comes good news, and out of your mouth come cursing. And so, so there's another comment here. I just realized you're finished. Thank you. I enjoyed what I heard so far. We will come back to watch and get the full teaching. Yes, this has been recorded, so yes, you can get the full teaching. And so, I guess we can close here, and I'll close with a word of prayer. And certainly, if our doctors would like to say anything else before I close in prayer, anybody would like to any closing words or prayers?
I just wanted to say a big thank you to Lady D for this amazing work she's doing. I wanted to thank you, Dr. Jones, for your wonderful moderation, and Dr. Carter for inviting me. It's been wonderful. I'm excited to be a blessing to someone. Thank you so much. Thank you, Jay, for handling the media for this.
Thank you, Jay, and Dr. Jones. Thank you.
Well, Lord, we just thank you for this word. We pray it would not return void, but it shall do that which you please and prosper in the thing that you said it. You said it. You proposed it. You bring to pass. You do it. Hasten your word to perform it. Lord, we need prevention. We need the truth that sets us free. We need a healthy mouth. We need you, Lord. And we thank you, Lord, that you give us a godly appetite. Give us food that's convenient for us. Help us to eat those things that will build us and strengthen us to be stronger believers, especially in these latter days. And I just thank you for these very knowledgeable presenters. We just give you honor and praise for Dr. Carter and Dr. Harold.
Thank you.
And we just thank you for Jay. We give you honor and praise, Lord. And we give you so much appreciation, Lord. This word needs to get out. And we thank you for this channel and all the different ways it is being broadcast. And we thank you, Father. We thank you so much for Lady D. And we give you honor and praise for her ministry and her church. What a wonderful presenter and prophetic proclaimer that she is to heal the nation. In Jesus' name, amen.
Amen.
Okay, Jay, it's all yours.